What's up, everybody? How you doing?
We're back.
Back again.
Yeah.
Frank's not sorry that
No.
it's not this time.
No, we'll hurt you if you don't subscribe.
All right, today we wanted to talk about sports physicals, how to help young athletes prepare and get ready for their sports season, either in the spring, fall, or even the wintertime sports. And Shannon's actually going to talk a little bit more about this with how she would approach an orthopedic physical exam. I think she has some good experience about this, so we're gonna kind of let Shannon start this one off and talk about that.
All right, so now that we're coming into the spring, it's gonna be time for junior high and high school athletes to get ready to do their sports physical for the upcoming school year in the fall. And so what a lot of people will do is kind of go to their family physician, get cleared for sports participation, and then head into the fall without really any great preparation or assessment of possible injury risk. Some of the kids have never really participated in extensive sports before. So what I think would be of great value to a lot of our young athletes is to do a comprehensive evaluation. So including the sport physical, that's the compliance with the form required by the states or the school districts, but then also doing a little more in-depth analysis of their mobility, their strength, their quality of movement with squatting mechanics, overhead reaching, a joint assessment to look at, whether there's some potential for injuries. If we have overly mobile joints or overly stiff joints, flexibility, all those things can be kind of a comprehensive evaluation that we can do from an orthopedic perspective in a little bit more detailed physical assessment. And then what would happen with, say, Dr. Lytle, is that he does a whole system evaluation, right? A whole body, or he's going to do blood pressure, and he'll talk more in depth about what that would include. But on my end, it would be more like a comprehensive orthopedic evaluation where we really get down to the details of examining each part of the body, looking at where we might kind of dial in a workout with someone like Frank, and avoid potential risk injury coming up in the fall.
Good job, Shannon.
Moral support. So I can kind of talk about the actual physical exam that you would do through, and since we're in Arizona, it'd be the Arizona Interscholastic Association, but every state's going to have one of these associations. So typically it's a little bit of the background information on the athlete, whether they're younger. This may apply more to the teens, like in high school. I don't know if grade school kids would have to fill these out to...
Not to my knowledge, but junior high, they do have to have a clearance.
Yeah. Okay, that's kind of what I thought. Some of the questions on here, there's actually more detail on here and questionnaires than you would probably imagine on the medical side of things. But it's going to ask for allergies. It's going to ask for previous medical history. There's even history of like abnormal imaging, a joint injury on like x-rays, and so it's gonna ask a little bit about previous medical history, if you've ever had certain stress fractures. Probably going to talk about the cardiovascular system of the young person, if potentially they have an enlarged heart. Now you probably have to do imaging to really see that, like a chest x-ray probably would show you some of that information, or if they have an abnormality with the lungs. So cardiovascular, heart, blood vessels, any issues with the lungs, because essentially that's needed for all sorts of sports and physical activity. Shannon kind of mentioned joints. So if there was any joint abnormality there, some people can be born without certain ligaments in their joints. I think in their knees, some people may not have like an ACL or PCL, or they have one and not the other. And the only way you'd really find that is through a physical exam or just imaging on those areas. Let's see. There's even a patient questionnaire in here on mental health, mental status, depression, anxiety. So the PHQ-4 is for anxiety and depression, which is kind of cool that they do that, just to screen kids for any sort of psychological issues that could be going on that sports could either make worse or better. And then there's even family history that they go through. Enlarged heart is on here, kind of like I had mentioned before. Any sort of dilated blood vessels of the heart. That could potentially, if it's like a family history of that disease, then you'd probably want to do a little bit more digging in that child. I don't think anything else on here. One thing I was thinking about was that sickle cell disease kind of occurs more so in the African American population, but that would be something where I would think blood tests would have to be done. If you suspected or if sickle cell ran in the family, I probably think you'd have to get a blood test to see if you are more likely to have that or experiencing that. Because there's some acute pain that's associated with that. My wife's actually a nurse. She's treated sickle cell patients when they come into the hospital, and that can be quite painful because those cells can form clots or they can form a stenosis in the veins, and you can get some ischemia where you get low oxygen levels, and you would get kind of similar pain with that as you would with maybe like a clotting risk for somebody that would have like a DVT type pain. So definitely something to look into, and if you have a family history of some of these diseases, certainly get your child screened beforehand just to minimize any risk associated there.
Now, do you think it's worthwhile getting young athletes basic blood work, or only if they have some risk factors?
I would probably say once they get into high school, I probably would look at basic blood work. Now, grade school, maybe if you had a suspicion that something was going on, you probably could. But I'd say in high school, they're going to become more active. They're going to be doing probably sports practices almost every day. Mm-hmm. So it gets to almost be like a full-time thing. So I'd probably say they want to address more medical needs at that point. Mm-hmm. The sports are becoming more serious in high school and certainly in college as well. So I'd say that's probably a good time to do it.
I don't remember if I got blood work when I was younger.
I don't think I
did.
did.
They probably didn't push it,
yeah,
back in the day. But it's probably more something that you want to do now.
Perhaps, especially with nutrition being maybe a little suspect. Are there certain tests that you do that are more comprehensive in looking at nutritional deficiencies, that kind of thing?
Yeah, so you can order specialty tests that look at certain nutrients that child would have, and it would even give you like an antioxidant chart on there to see if the child is kind of low in antioxidants or if they're low in certain vitamins, minerals. So there are some specialty labs that you could look into. I'm able to run those for anybody, but athletes as well. Routine blood work is going to show you some things too. If you run like an iron panel, CBC is going to give you some information on if you may be iron deficient or deficient in B vitamins too. So the routine blood work can even look for vitamin D as well. But a nutrient panel would be really good to test for, especially before a season starts, or if your child has never gotten blood work before. That could be something just to cover your bases and say, okay, what kind of supplementation does my child need for this sport? And then you could maybe go a little bit more in depth with sport-specific supplements, and we could probably talk about those even at the end of this video. Frank can kind of mention some more sport-specific things that kids can do that would be safe.
Yeah. And I think it all depends on the parent too, right?
Yeah.
Parents, what they would want to run. Oh, I want to do all that, or I want to do that.
Yeah.
Or it depends how in depth they want to get, because the kid can't really decide if he's underage,
Yeah.
So imagine on the parents.
Mm-hmm.
I don't think I got blood work. I don't think I did. I don't think
I ever did. Yeah. So Frank, tell us what you would do as far as helping young athletes get prepared, maybe like at the end of spring through the summer, to help prepare for participation in the fall or winter seasons.
The biggest thing that I always tell, first of all, is make sure you're doing your exercises right. I mean, because bottom line is, you develop a bad habit when you're young, you're going to have that bad habit, especially like with a squat or a deadlift or a clean, anything like that. I think the biggest thing is you want to make sure you're doing the correct form and making sure you're firing the right muscles. Because if not, then you'll start to see Shannon. And I forgot to tell you, good job, Doc. All right. And then you don't have to see Shannon because you start using muscles, you start tearing ligaments, you start getting chronic pain or whatever. I mean, I've had people that, 15, 16 years old. I had one gal that she was a softball player, and all she did was throw it to her right arm the whole time. And it was the point where she could not, the flexibility in her that arm was terrible because, she was 15. So, it's just important to condition your body right too, because a lot of times, some young athletes, they won't even work out. I think that's important to work out.
They only do that one thing in sport, right?
And you want to do both sides of your body. I mean, like when you're doing, that's the biggest key is I think is a lot of times is doing both sides of your body. A lot of people are like, oh, I just got to worry about this for throwing a baseball or whatever.
Right.
Instead of doing both sides, make sure you're getting both sides work. And that's where sports specific would come in, where you're not going to train a tennis player like you're going to train a football player. And then if you train football player, you're going to train a lineman different. You're a running back, you're then a receiver, then a defensive back, or a linebacker. I mean, it's all sports specific. And I think that's the most important part is don't train everybody the same exact way. You got to be specific to that position, sport, whatever. And that's one of the biggest keys is to make sure that you do that. And again, emphasizing back on, it's just, you got to do it safely because I've seen so many kids that get these bad habits, and it's like, you're young and you do these bad things and you start straining your back, you start doing that. So I think that's just the biggest key and you want to always continue to try and challenge yourself too. I mean, the biggest thing is, I know when I was younger, I overtrained big time. I put every body part every day. When you're 15, you can do that though, but again, biggest thing is don't overtrain either. I mean, that's the biggest thing is a lot of people, they want to do more and more and more. I think more is better, but it's not. Rest is just important. The proper nutrition is important. The whole thing, and that's another thing you develop when you're young too is the nutrition. Going to, if you have a good hard workout and go to Whopper Burger King, it's not the most nutritious meal. So, I mean, that's what you want to make sure you're eating the right types of foods too, and that's part of becoming a efficient, great athlete is eating the right stuff, making sure you get proper screening, stuff like that to make sure that you're doing everything safely so you don't get injured. So that's pretty much what I would do with individuals as far as to get them on the right path and to play their sport.
Great.
So, yeah.
Now, do you do sport specific?
Yeah, I've trained.
Because I know you did that in the past.
Yeah, I did. I wrote the programs for Mike's football team. So yeah, I've done it many times. I trained pro rodeo girl for a while, football, baseball. I don't do that much, but I've done it fast. Yeah. I mean, like I said, I know what to do, and I wrote programs for young kids. But I mean, our people that come here usually aren't, athletes. They're more, people get in shape.
The weekend warriors.
Yeah, exactly. But yeah, I mean, we'd love to have more athletes here. I think it's great.
Yeah.
I mean, we know what we're doing. We do. Trust me, we know what we're doing.
Well, Shannon, you definitely see a lot of athletes.
Yeah.
So
yeah.
Athletes, bodybuilders, I put all those in that category. So you definitely are seeing a lot of those people too. So let's kind of talk about some of those maybe supplements or nutrients that you guys may have, talked to your athletes about and maybe encourage them to do either, in high school or college, or what are some of those? We can start with you.
Well, for me, I just always tell people, you got to be careful a lot of the athletes like to do the creatine, but you got to be careful if you're too young. You want to do too much of that. It'd be hard on your kidneys. If you're not drinking enough water, it's going to put a little strain on your kidneys. So I always think just at that age, a good multivitamin, just a good quality multivitamin is good. And make sure one of the biggest ones is make sure you get proteins. Most people don't get enough protein. I mean, that's the biggest thing is make sure, you should do about half your body weight in grams. So if you're doing 200 pounds, you should do 100 grams of protein a day. Even if you're an athlete, even a little bit more than that probably, maybe like 120. Yeah, I'd say 120. And it depends how active you are. I mean, if you're a two sport person, you may want to, a gram per body weight.
Well, if they're training and they're going to practice every day after school.
Yeah, so you could probably
they're going to need a lot.
That's what I'm saying. And you could probably do, if you're 200 pounds, you could probably do 200 grams of protein all day long.
I think hydration is a biggie, especially here in areas where it's really hot. They start training over the summer. Hydration, electrolyte replenishment, right? I mean, lots of complaints of cramping, right? Issues with cramping. So staying ahead of that, I think with the hydration, getting enough salt, that's probably more your area of expertise with magnesium, enough salt.
Magnesium,
enough
potassium,
water,
calcium.
Yeah,
you definitely need the sodium. Those are the biggies there. Chloride.
Pickle juice.
Pickle juice, yeah.
That's good with what's it called?
Well, I think vinegar can
vodka.
help.
What's that called? Fireball.
Kids.
Fireball.
We're talking about kids.
Not for you guys, I'm for me. Not
before
not for you guys, yeah.
Somehow it always turns down.
Yeah, not for the kids. We're not encouraging your kids to drink Fireball. No.
Yeah, I think electrolytes is good. I think another thing that, when you do like soccer practice and, moms used to bring like the oranges, I think they were like on the right track there. I've always thought that, we're in Arizona, we can actually like grow dates you know, on the trees and stuff like that, which is kind of cool. Dates would be like a great like sports snack for recovery, especially like explosive like sports, like if you're doing track, if you're swimming, I'd probably say any sort of running there. If you were doing workouts like explosive movements, you know, the speed, strength type sports, just that instant glucose is going to be helpful for getting the blood sugar back and getting the glucose back into the muscles. Because those fast twitch muscle fibers, they're usually whiter, they have less hemoglobin, and they're glucose dependent muscle fibers, so they need blood sugar. They don't necessarily run on ketones, more so the slower twitch muscle fibers, the more red fibers that are higher in hemoglobin, those will run on ketones. So you don't necessarily need the blood sugar there, or the glucose for that. So yeah, you would kind of mentioned creatine, and I think back in the day, creatine was kind of, they didn't really, I think there was some misinformation on creatine, but there's so much research on creatine now that people can go online and they can find it. If you do have a past kidney disease or pathology there, you probably do want to be a little bit more careful. But I think for most people, they'd probably tolerate it really well.
Yeah.
And the only thing that would happen is, maybe like a stomach ache. And you don't have to take a whole lot of it, but it would be good.
I need to start doing that again. You told me to do that when you gave me my plan. I just haven't done it yet. I need to, because you said the 0.25, just do very little.
Yeah.
It's not like sometimes it bloats you a little bit. So
it can.
Yeah.
So you just have, if you do get bloated on it, just reduce the dose until you don't get bloated. And you don't even have to do a loading phase. You can just take some, like with your protein powder or something like that. But I do think protein's good. I think probably high carbs the night before a work, like a game or like a big practice would probably be good.
A lot of protein too.
Yeah.
That means make sure that you get healed up good. Yep,
yeah,
for sure.
And just reducing inflammation, getting your electrolytes. If you need to help recover, we could probably make some more in-depth videos on this, more sports-specific performance enhancements and medical things that you can do for both recovery with sports, but also for sports nutrition. We could go in more in depth on this.
We can make you a beast.
Video. Yeah, we can make you a beast.
Yeah.
You and your kids a beast.
Yeah.
I think that was everything that we were going to cover today.
Yeah.
So if you like our content, certainly like our videos, leave comments, good or bad.
Subscribe.
Subscribe for sure. Subscribe to all of our channels. Go on Instagram.
Or Doc will hurt you.
This is a safe space. Safe space. Frank keeps everybody safe in here. His bouncer instincts come out. Keeps everybody safe. But so if you like our content, certainly go to Instagram, go to Facebook, go to our Rumble, even go to our TikTok and kind of see more of our short content there. And if you have ideas for things that you'd want us to cover in the future, certainly put that in the comments section. So we'll see you on the next one.
All right.
Do good things.
Yep.